Greetings, loved ones. While physical injuries may or may not be immediately visible, abuse and neglect can have consequences for children, families, and society that last lifetimes, if not generations. The impact of child abuse and neglect is often discussed in terms of physical, psychological, behavioral, and societal consequences. However, it is impossible to separate the types of impacts. Today we are going to talk about long-term consequences of child abuse and neglect. Help us get these messages out. Please subscribe to our channel. Follow us on Facebook, Instagram, and Twitter. Hit the like button and the notification bell, and please share these messages with others. You could save a life. Let's talk about the long-term consequences of child neglect and abuse. Physical consequences, such as damage to a child's growing brain, can have psychological implications such as cognitive delays or emotional difficulties. Psychological problems often manifest as high-risk behaviors. Depression and anxiety, for example, may make a person more likely to smoke, abuse alcohol or drugs, or overeat. High-risk behaviors, in turn, can lead to long-term physical health problems such as sexually transmitted diseases, cancer, and obesity. Not all children who have been abused or neglected will experience long-term consequences, but they might have an increased susceptibility. Today we're going to explain these long-term physical, psychological, behavioral, and societal consequences of child abuse and neglect. First, let's start with the factors that are affecting the consequences of child abuse and neglect. Individual outcomes vary widely and are affected by a combination of factors, including the child's age and developmental status when the abuse or neglect occurred, the type of maltreatment, physical abuse, neglect, sexual abuse, etc., the frequency, duration, and severity of the abuse, and the relationship between the child and the perpetrator. Researchers have also begun to explore why, given similar conditions, some children experience long-term consequences of abuse and neglect while others emerge relatively unscathed. The ability to cope and even thrive following a negative experience is often referred to as resilience. It is important to note that resilience is not an inherent trait in children, but results from a mixture of both risk and protective factors that cause a child's positive or negative reaction to adverse experiences. Several protective and promotive factors individually, within a family, or within a community may contribute to an abused or neglected child's resilience. These include positive attachment, self-esteem, intelligence, emotion regulation, humor, and independence. So what are the physical health consequences? The immediate physical effects of abuse or neglect can be relatively minor, like bruises or cuts, or severe, like broken bones, hemorrhage, or even death. In some cases, the physical effects are temporary. However, the pain and suffering they cause a child should not be discounted. Child abuse and neglect can have a multitude of long-term effects on physical health, and NSCAW researchers found that at some point during the 3 years following an abuse investigation, 28% of children had a chronic health condition. Let's talk about abusive head trauma. Abusive head trauma is an inflicted injury to the head and its contents caused by shaking and blunt impact. It is the most common cause of traumatic death for infants. The injuries may not be immediately noticeable and may include bleeding in the eye or brain and damage to the spinal cord and neck. Significant brain development takes place during infancy, and this important development is compromised in abused children. 1 in every 4 victims of shaken baby syndrome dies, and nearly all victims experience serious health consequences. Let's talk about impaired brain development. Child abuse and neglect have been shown to cause important regions of the brain to fail to form or grow properly, resulting in impaired development. These alterations in brain maturation have long-term consequences for cognitive, language, and academic abilities and are connected with mental health disorders. Disrupted neurodevelopment because of abuse can cause children to adopt a persistent fear state, as well as attributes that are normally helpful during threatening moments but counterproductive in the absence of threats, such as hypervigilance, anxiety, and behavior impulsivity. Let's talk about poor physical health. Several studies have shown a relationship between various forms of child abuse and poor health. Adults who experienced abuse or neglect during childhood are more likely to suffer from cardiovascular disease, lung and liver disease, hypertension, diabetes, asthma, and obesity. Specific physical health conditions are also connected to an abuse type. One study showed that children who experienced neglect were at increased risk for diabetes and poor lung functioning, while physical abuse was shown to increase the risk for diabetes and malnutrition. Additionally, child abuse has been shown to increase adolescent obesity. A longitudinal study found that children who experienced neglect had body mass indexes that grew at significantly faster rates compared to children who had not experienced neglect. And then there's psychological consequences. The immediate emotional effects of abuse and neglect, like isolation and fear and an inability to trust, can translate into lifelong psychological consequences, including low self-esteem, depression, and relationship difficulties. Researchers have identified links between child abuse and neglect and the following, such as difficulties during infancy. Of children entering foster care, in 2010, 16% were younger than 1 year. When infants and young children enter out-of-home care due to abuse or neglect, the trauma of a primary caregiver change negatively affects their attachments. Nearly half of infants in foster care who have experienced abuse exhibit some form of cognitive delay and have lower IQ scores, language difficulties, and neonatal challenges compared to children who have not been abused or neglected. Then there's poor mental and emotional health. Experiencing childhood trauma and adversity such as physical or sexual abuse is a risk factor for borderline personality disorder, depression, anxiety, and other psychiatric disorders. One study using ACE data found that roughly 54% of cases of depression and 58% of suicide attempts in women were connected to adverse childhood experiences. Child abuse also negatively impacts the development of emotion regulation, which often persists into adolescence or adulthood. Then there are cognitive difficulties. Researchers found that children with substantiated reports of abuse were at risk for severe developmental and cognitive problems, including grade repetition. More than 10% of school-age children and youth showed some risk of cognitive problems or low academic achievement. 43% had emotional or behavior problems, and 13% had both. They also have social difficulties. Children who experience neglect are more likely to develop antisocial traits as they grow up. Parental neglect is associated with borderline personality disorders, attachment issues or affectionate behaviors with unknown or little-known people, inappropriate modeling of adult behavior, and aggression. According to the CDC, over half of all the children in the world, that's 1 billion children ages 2 to 17 years, experience violence every year. The question is not if you'll encounter a victim of violence. The question before God is, what will you do when you do encounter them? You could be the person who saves a life. You are called. We are all called to be champions for justice. Those who suffer violence, they need to know that those who love them and those who don't even know them will reach out to them and give them the help they need before it's too late. Help us get these messages out. Please subscribe to our channel. Follow us on Facebook, Instagram, and Twitter. Hit the like button and the notification bell, and please share these messages with others. You could save a life. If you're a victim of violence, I want you to listen to me. I want you to know the truth. You are valued. You are loved. You are intelligent, and you are worthy. God does not want you to suffer violence. He wants you to live free from violence in peace and tranquility. And there is a way out. It's not your fault. Abuse is not love. And most of all, you're not alone. If you are a victim of violence, reach out to someone today. If you find yourself in a dangerous situation, call 911 for help. And if you know of a child who is suffering violence, tell the authorities. In our next episode, we're going to continue talking about long-term consequences of child neglect and abuse. Until then, God bless you.